morning. Welcome to e-Pathshala. And under the subject of social medicine and community health, we are going to continue talking about healthcare delivery system. And today we are going to discuss the job responsibilities of the health worker, male and female. Thanks, first of all, to Professor Vidya-mitra and his team from Aligarh Muslim University for giving us this wonderful lecture. And coming to the learning objectives. Learning objectives, as usual, is to emphasize what are the job responsibilities of health worker, male and female, especially the male workers in malaria, tuberculosis, leprosy, and their role in preventive healthcare, school healthcare, including nutrition and record keeping. Job responsibilities of health worker female, that is also known as the A&M, and they are posted mostly at the sub-centers in maternal and child health, family planning, MTP, and her role in universal immunization program, nutrition, guides training, vital events, and record keeping. Now, in keeping with the requirements of the village population, whether talking is required to the males or to the head of the family or to the elders in the family, and then talking to the females, motivating them for a regular checkup. So the functions of actually the health worker male and the health worker female are divided equally and responsibly. Now, to introduce this particular subject, now where are the health workers? Both male and female, like I said, are posted in the sub-center. Sub-center should essentially have only one male worker and one female health worker for a population of 30,000, because these 30,000 will be divided into nearly 4 to 5 sub-centers, and these people are working at the sub-center level. Now, male health workers are also known as the multi-purpose workers, and female health workers are also known as the auxiliary nurse midwife. Now, these people have training in their respective subjects. The auxiliary nurse midwife undergoes a training of nearly about 6 months in a district hospital or in a smaller hospital, wherein she learns what is MCH, what is antenatal care, and if necessary, how to deliver only the normal cases, not the selectively chosen high pressure cases, because the high-risk cases will always be referred to the senior, to the lady health visitor or to the primary health center. Now, the primary focus of the sub-center actually remains on the reproductive child health services. In this module, we will be discussing their job responsibilities of both the male and the female health workers and how they coordinate both these activities along with the instructions from the primary health center doctors. Now, these are some nice pictures to show you all about the auxiliary nurse midwife facilitating ANC visits of women in the Marwa Toli village in Bihar's Kishanganj district. And the second one is the male health worker talking to the males and maybe health educating them or collecting data. Now, one thing we must remember, in keeping with the requirements of the dress code which is required in the area, thus the A&M as well as the male health worker have to be dressed very appropriately so that they are actually dignified personnel who will be accepted wherever they go. And this is, like I said, the multi-purpose health worker, Mr. Gajraj Singh. He registers the death of Mohoro in Dayalpur, Balso. That means registration of deaths also comes under his notification, and registration of births comes under the notification of the A&M. Of course, and both help each other. Wherever situations are difficult, it is mostly both of them go together. Now, now let's talk about the male multi-purpose health worker. And mainly the focus on activities which are related to disease control, programs, detection, control of epidemic outbreaks, environmental sanitation, safe drinking water, first aid, treatment of common illnesses, logistics, supply management as sub-center. In addition, he also facilitates, like I said, the A&M, his co-partner in MCH, family planning, nutrition related activities, where, for example, if there are family welfare camps, then the presence of both the male and the female worker are go hand in hand and are required and are essential. Because in case a woman comes and she is in ghungat or parda and she refuses to talk, like in most of the village families, so it will be the male health worker who will talk to the husband of the husband of that lady and motivate both of them to accept the family planning measures as are required. Now, the broad areas of job responsibilities include, actually for the male worker, is in malaria. The national, now we must remember, like I've been telling you, the national programs, the national health programs of malaria, tuberculosis, filaria, they are all going on, and all of them are channeled through the primary health center, through the sub centers. And who are the workers? These are the workers who are actually carrying out the domiciliary house-to-house visits and the field level working. Now, in malaria, his visit will be visiting from house to house, collecting blood smears and give the treatment, refer seriously. In other words, keep a full eye on the people concerned. And similarly, tuberculosis. Tuberculosis, he has to actually go from house to house. Whatever number of houses are there, one quick round will tell him all to identify all cases of fever for 2 weeks with cough or spitting of blood, and then he also functions as a DOTS provider, because he may call them to the sub center or he may even go to their houses to give them their weekly medicines. Then he improves community awareness all the time. Information, education, and communication activities are a must if we want any program to succeed at the grassroots level. Assist and supervise the ASHAs, the Anganwadi workers, the village health guides. So these are the gamut of technical, knowledgeable people who are working at the primary healthcare level, and they are meant to contact each and every village personnel. Local health volunteers to function effectively as DOTS providers, and of course maintain cards and records. In leprosy, the same as in tuberculosis, he has to identify the suspected cases of the skin patches with loss of sensation. See, because people may have these infections, may have these diseases and may not bother about it. So it is the male multi-health purpose worker or the female who go from house to house, and if they come across any person with such a case, then they refer to each other so that there is immediate attachment of the case. So you identify the case, refer them to the PHC, provide the multi-drug treatment, and guide the patients with deformity. And later on, if necessary, he will be the guiding factor to take them for rehabilitative surgery at the FRU. Then he also assists and supervises the ASHAs and the Anganwadi workers. In all these programs, they are all working hand in hand. Now, in preventive health care, surveillance for high incidence of various diseases, and they have to notify the primary health center. That means if they are walking from place to place and they find cases of fever, with rigor, or they find cases with swelling in the legs and night rise of temperature. So all these, just by talking to them, they know that they have to refer the cases well in time so that they are caught and diagnosed as soon as possible. If there are sudden surge of diarrhea cases, they will ensure regular chlorination, they will collect water samples, and they will also generate community awareness. At times, they hold the evening meetings under a tree and with a laltane burning. So that itself creates an atmosphere of education, understanding, and improvement of interpersonal relationships. Then they must create awareness regarding safe drinking water, sanitation, waste disposal, personal hygiene. A word about safe drinking water. Now, most in the olden times, and we are talking about 20 years earlier, there were wells which were being chlorinated, which had to be chlorinated, and wells were the source of drinking water. So people would come and take it, carry it in the buckets. In the desert areas, they had to walk miles in order to carry this. So throughout the country, each and every health worker is facing a different sort of problem with the same factor, that is drinking water. And in each area, whether it is in South India, whether it is in Rajasthan, whether it is in Bihar, whether it is in UP, so these people, or it is in the hilly areas, they have to match what are the requirements of the drinking water necessity for the people, and therein see what important factors must be taken. Now, for example, in the deserts, they are bringing water from a long distance, and we have to remember that was the age when guinea worm was not eradicated. So they had to filter the water. In places, I have known places in South India where you have to dig into the dry rivers and take out the water. So you have to filter the water, although that is drinkable, but you have to filter the water. In other places, you have to chlorinate the wells and chlorinate them regularly, because these wells are open, they cannot be closed, and they are open to the weather, to the trees which are growing, and to the dirt which flows. So therefore, regular chlorination, looking after the water right from the source to the place where it is required for drinking. Sanitation, waste disposal, very important, because we talk of dooryard pollution. Small children who have not been potty trained, they go just outside the house, or they will sit at the angan in front, and they will pass the excreta there and leave it there. Nobody bothers to clean it. So this is a form of inviting spread of infections. So therefore, we are likely to land up with gastrointestinal diseases. And personal hygiene is, because nobody is going to keep soap there. So teaching in all these problems, is important. Assist and coordinate with the VHSC and the SHC, the sub-health center, the primary health center committees for health awareness and preventive. One of the important functions of the male health worker as well as the female health worker is the school health, including nutrition. Now, we have always been emphasizing the importance of school health, wherein the medical officers have to organize and have to visit all the schools and advocate personal hygiene, nutrition, safe drinking water, sanitation. You see, the health education part is carried out by these peripheral workers, and whereas the medical examination is being done by the medical officers, who will undertake to check for hearing, for blindness, for growth, for other anomalies. And these people undertake awareness generation of national health programs for early detection of diseases. They have to ensure complete immunization in the school health program. In which case they will be needing actually tetanus toxoid, all the 3 doses, and they have to assist the ophthalmic assistant for eye screening of the children and identify malnutrition. In eye screening, they will also see for weakness in the eyes, for refractive errors, as well as for night blindness or color blindness. Then they have to identify cases of malnutrition in school children, and they have to refer accordingly. These will only be discovered if they start taking weights and measurements regularly. And under the universal immunization program, we have to administer the vaccines to all the children according to the guidelines in collaboration with the health worker females. We have to assist the health worker female in administration of tetanus toxoid to all the patients, to all the pregnant women. And they have to assist the health supervisor in the school health program and of course generate community awareness. Mind you, we are still talking about the functions of the male health worker. In the vital events, it is necessary that he inquires about the births and deaths occurring in his area. He records them in the births and the deaths register, reports them to the health supervisor male or to the A&M, and educates the community on the importance of registration of births and deaths. So this is important because normally people take it very easy that okay, a baby has been born, kabhi na kabhi register kar hi lenge, but that's not it. Within the required time, they must register the births as soon as possible. Now, reproductive health, child health, we have been discussing a very important program as far as the parental areas are concerned. Family planning program for the eligible couples, they have to motivate for family planning, distribute conventional contraceptives and oral contraceptives, help prospective acceptors of sterilization in obtaining the services. They provide the services to the male family planning acceptors, and they build rapport for promoting family welfare programs, educates the community on the availability of the service of MPP, and identify the women requiring help of MTP. Now, in cases of MTP, particularly in the village setup, maybe both the male and the health worker female will have to actively help both the partners in order to understand the importance of family planning as well as family the MTP. And in case the woman is scared, then maybe the husband will have to accompany her to get the necessary interaction done. And most important, they have to educate community on home management of diarrhea and ORS. So then another important thing is not only home management of diarrhea, but if there is an outbreak of diarrheal disease in more than the required number, that is, all of a sudden you have about 5 cases in the neighborhood or 6 cases at the same time, then we would definitely consider there is something wrong, some infection is going wrong, so they have to contain it. Now, this is a chart which says family planning, child survival, safe motherhood, planned approach to healthcare, prevention and management of the STDs and AIDS. See, these are all programs which have to be looked after by these people, coordinating with each other's activities. And mind you, all these are dependent on each other and they have to be carried out at the peripheral levels. Most important, it's not only that you visit the field and you talk to them, but unless you keep records are important, documents, so that we can judge the progress of the program, and we can, like I've always said, we can make mid-course corrections, we can improve, we can introduce improvements. So that is important. Now, record keeping, all facilities in this area, prepare and maintain maps and charts, maintain family and health records, assist the health worker female to prepare and maintain the eligible couple and the child register, maintain the cases of tuberculosis, leprosy. So whatever work they are doing in the field, it has to be recorded, and they have to prepare or submit the prescribed monthly reports to the health supervisor male, who will be posted at the primary health centers. Then they have to, of course, maintain the passive surveillance register for the malaria cases and keep a lookout for the active cases. Now, the health worker female, she is the opposite counterpart of the health worker male, and she is also known as the auxiliary nurse midwife because she is the one who now focuses on family health welfare. Family health welfare mainly focuses on activities which are related to MCH, family welfare, and nutrition related activities. In addition, she will also facilitate the multi-purpose health worker in disease control programs. So if there are any outbreaks, any any epidemic situations, it is everybody who pitches into health. Environment, sanitation, take care of the drinking water, give first aid, treatment of the illnesses, and most important, if anybody is serious, logistics of transferring this patient to the FRU or to the primary health center wherever medical aid is available. Now, her broad job areas of responsibilities also include, most important of course, the maternal and child health. Now, for her, it is important to go from family to family. House visits must be done in all the villages, and an outreach of every single house must be attended. So, registration of a pregnant woman for ANC, ensure at least 3 antenatal visits, and she provides the antenatal care and the IFA tablets, and gives the tetanus immunization. Talks about it. If it's a first delivery, she has to give all the 3 doses, but subsequent she has to give only the 2 doses. Then she must test the urine for albumin and sugar and estimate the hemoglobin. And in case she is anemic means below 10 grams, then she will definitely, in any case, she will have to be given iron folic acid tablets, and she has to refer all the pregnant women to the PHC for the rapid tests. Then refer cases of abnormal pregnancy and cases to the health assistant female, because she's a senior, more experienced, and she can judge the cases better, or she has to refer to the primary health center. She also makes an attempt to conduct deliveries in her area when called for. Normal deliveries, if it's possible that the traditional birth attendant may call her for additional help. So in that case, there will be 2 women who are organized, who are trained, semi-trained, the other one is fully trained, to conduct the delivery right at home. And she supervises the deliveries conducted by the guides and assistant. Refer cases in case there are 2 or 3 women who are going to deliver at the same time. She gives the normal cases to the traditional birth attendant, supplies her with the necessary kit for a safe and healthy delivery, and looks after the rest herself. She refers cases of difficult labor in newborns with abnormalities, disbursement to the beneficiaries under the Janani Suraksha Yojana, makes at least 2 postnatal visits, assesses the growth and development of the infant, and educates the mothers for better health, including maternal and child health, family planning, nutrition, immunization. Then, of course, she has to assist the medical officer and the health assistant female in conducting antenatal. If her seniors come into the field, then she must accompany them and help in the antenatal and the postnatal clinics at the sub-center level. Then family planning, another important, because family planning, she has to literally carry it every day in her bag. She maintains the eligible couple registers, spreads the message of family planning, continuous education to the women, to support them, to motivate them, and to request them to accept the family planning method. Couples motivate them for family planning, distribute the conventional contraceptives, in other words, distribute condoms or distribute the oral contraceptive tablets, which are supplied by the primary health centers, and she provides follow-up services to the female family planning acceptors and refers those cases that need attention by the physician. In case she is a very weak woman and she says she doesn't want the tablet, she only wants the IUCD, she will definitely have to refer this case to the higher hospital or the higher center. Then she has to establish the female depot holders, assist the health assistant female in training them, and provides a continuous supply of conventional contraceptives. In other words, the supply of oral contraceptives should not be lost. She, of course, builds rapport with the acceptors, village leaders, ASHA, DAIs, and the others, and utilizes them for promoting family welfare programs. She also identifies the women leaders for training family welfare in the family welfare programs, and most important, participates in the Mahila Mandal meetings and utilize such gatherings for educating women in family welfare programs. She may also at the same time knock on the door with other programs like adopting good nutrition health measures. Then medical termination of pregnancy. Slightly delicate matter, but where necessary and where she knows that this lady needs help, she must refer the case within the specified time so that the woman requiring help is able to get it, and she refers her to the nearest approved institution. So that means she may refer her to the primary health center, or she may refer her to the first referral unit, that is the CHC. Educate the community and consequences of septic abortion. This is very important. Not now, not in this late 21st century, but yes, in the latter part of the 20th century and in the 21st century, septic abortion was one big problem which was responsible for a high number of maternal deaths because women were shy to come forward, abortion was a taboo, so they would get it done. We have actually seen cases done by untrained guys who may insert all sorts of unknown objects in order to produce the abortion, thereby leading to septicemia and eventual death in most of the cases. So this is a complete no. And she must inform them about today abortion is absolutely safe, it is legal, and it can be done under proper care. Nutrition, very important because it is easier to catch. They have an under 5 program, and in the under 5, the children right from 1 year to 5 years are in that program. So it is, and you are weighing them, measuring them, so you exactly know what is the growth pattern of each and every child. And if necessary, she is able to identify them and give them proper health education to feeding them and putting them on the right path of growth. She also distributes iron and folic acid, educates the community about the nutritious diets, and most important, administers vitamin A solution to the children. The earlier, the better. And this keeps the night blindness away and weakness in the eyesight. Most important, she coordinates with the Anganwadi workers because Anganwadi workers' most important function is nutrition of the under 5. In the universal program of immunization, her most important duty is to immunize pregnant women with tetanus toxoid, administer vaccines to all the infants and children, and ensure injection safety. Dice training, she must list the dice in her area and involve them in promoting family welfare. And she helps the female health assistant, her senior, or the lady health visitor in the training program. Now, these dice also undergo training programs, say one for every year, to keep them fit and to keep them knowledgeable. So at least these guys must be able, if they are doing part of our work, they must be able to sort out the normal from the high risk cases. They may deal with the normal cases, but the high risk cases they may shift to her superiors or to the health assistant female or to the lady health visitor in her area. Communicable diseases, along with the male health worker, they must notify abnormal increases in the case of diarrhea, dysentery, fever with rigor, rash, jaundice, because as a part of the national program, they must keep a lookout because they are actually lookout guardians in the field for us. So any case springing up out of the abnormal is important. Report, take steps. So take the necessary measures to prevent their spread, administer a presumptive treatment, and identify cases of skin patches with loss of sensation, notify, identify and refer all cases of blindness, and most important, education, counseling, referral, follow-up of the STI and the RTI and their group, and HIV/AIDS in case they have been registered. We identify all cases of filaria, notify them, and give all management. Vital events, one of the most important key factors in their functioning is the record and report to the health authorities of vital events including births and deaths, particularly of mothers, infants, and to the health authority. maintenance of all relevant records concerning mother, child, and eligible couples, and of course, treatment of minor ailments from their first aid kit. Actually, they carry with them a first aid kit in which medicines are actually given to them, just like the village level worker. So they can actually treat minor ailments and they can provide first aid for accidents, emergencies, or refer the cases to the competent authority. Record keeping, like any other person, जो भी काम करना है उसका record रखना है. So they have to maintain the register for the pregnant women, infants 0 to 1 year of age, women aged 15 to 44 years. I would also add children between 1 to 5 years. Maintain the prenatal and the maternity health records, eligible couple register, child register, maintain the contraceptive distribution and the IUCD register, and those couples who have been sterilized or are planning to get sterilized. So supplies must be given to them regularly and they must submit reports in time to the senior, that is a health assistant female. Maintain passive surveillance for the malaria cases. Now, team activities. We expect, in order to give essential primary health care at the field level, team activities of all these people concerned at the primary health center, at the sub-center, they must work as a team. So they attend and participate in staff meetings at the PHC community development block, coordinate their activities with all the health worker, male, female, ASHA, guides, coordinate with the PRI and the village health and sanitation committee, meet the health assistant, female or the male, each work, seek their advice, and maintain the cleanliness at the sub-center. Since these people are posted at the sub-center, so in a way, where they stay, where they teach, where they work, maintain cleanliness. Dispose of medical waste, very important. Any injections, any disposable syringes must be got rid of properly and safely. And they participate as a member of the team in camps and in camp activities. So in summary, the responsibility of the male public health worker mainly focuses on activities related to disease control programs, epidemic outbreaks, sanitation, first aid, treatment of minor illnesses, logistics, supply management at the sub-center. The A&M focuses on the MCH-related activities. In addition, she also performs the function of the maintenance of records. She also acts as a resource person for the training of ASHA. To end with, thank you for visiting ePaksha.